So today is May 3rd, 2022. Thank you for attending today's training on current research using NEMSIS data, presented by our own Ben Fisher, and I believe there'll be a guest spot by Angela. And I want to remind everybody to ask questions by using the chat function or taking yourself off of mute and asking your question that way. This session is being recorded and it will be posted onto our YouTube channel and to our website. If you'd like to be notified about events like these, you can subscribe to our Google group distribution list by going to nemsis.org and clicking the red button in the upper right-hand corner. Or you can also go and subscribe to our YouTube channel by going to the YouTube channel, clicking subscribe and ringing the bell. Then you will be notified when new videos are available. You can also find out more about the research using NEMSIS data because we do post about it on our social media channels. We are most active on Facebook, LinkedIn, and Twitter. So if you search for NEMSIS on any one of those, or if you go to the bottom of the website at nemsis.org, that will take you to links and you can subscribe to all of those channels as well. So now that I have taken taken up all this time with the housekeeping stuff, I'm going to hand over the time to Ben, and you can take it from here, man.
Awesome. My audio still doing okay?
Yes. So,
all right.
For now.
All right. Thanks, Chris. It sounds like having some audio issues. So if I cut out, I apologize, and we will switch to plan C. Well, I am excited to present today. We're going to talk about research using NEMSIS data, and then a little bit more about the research data set. Just some objectives. So after we overview a little bit about how NEMSIS works for anyone who is unfamiliar, we'll give 3 or 4 examples of some current research using NEMSIS data, how the TAC supports researchers, and what you can do to request your own research data. So just in case anyone is not familiar with how the NEMSIS data set works, we are a little bit of an exercise in federalism. So EMS agencies collect clinical data in the field using electronic patient care reporting software, usually on a tablet or laptop by an EMT or paramedic. That data then flows to a state office of EMS where they have a data repository. And then from there, it travels to the National EMS Information System, which is us. The data set gets consecutively smaller. It's a little bit like a wedding cake. So the largest set of data elements is available to EMS agencies, either as optional or custom elements, including state elements. Then at the state level, either through regulatory authority or by request, the state office may request state elements that are not collected at the national level. And then at the national level, we collect about 158 data elements. So this will become a little bit more important when we talk about some of the resources that are available as you look at NEMSIS data. So the national data set and the research data set only contains data elements that are collected at the national level. We have pretty robust state participation. We have, I believe it's 56 states and territories right now, with the last state anticipated to come on board very shortly. And we are going to close out our 2021 research data set with about 49 million total records and about 31 million 911 ambulance transports. And then we already have about, actually think it's a little bit higher now. This table's a couple weeks old, but we're close to 7 million records for 2022. So a really robust data set with a lot of EMS records. We've tried to quantify just how much data we have across the nation, and we think we're close to about 90% of EMS agencies in the United States. So we're getting really close to a census of EMS agencies that are producing EPCRs within the country, which is really impressive and I think really cool for research purposes. And we'll talk a little bit more about that with some of the examples, the sheer volume of records that are available to researchers. So right now, if you look on Google Scholar, we are cited in about 1,300 papers. That number continues to go up. Our 2020 data set was the most popular data set that we've ever had in 2021 when we published the 2020 data set. Because of the COVID pandemic and the timeliness of our data, we went from between 50 and maybe 100 data requests a year for the research data set to almost 350 research data set requests. A lot of that has to do with the fact that when you look at other federal healthcare data sources, they can be 2-3 years behind current calendar date. And that's considered timely for federal data sources. So the fact that we have an annual data set as well as the data cube that are updated essentially live, and then the annual research data set obviously is produced once a year. That means that this data can be used to evaluate kind of ongoing trends as they're happening in near real time. And that's both novel and extremely useful. So the first paper I'll talk about, Angela, if you don't mind pasting the links into the chat for anyone who would like to read these kind of or skim these as we talk about them. The first one is overdose surveillance. So the CDC publishes overdose fatality data that lags quite a bit. It can be about 2 or 3 years behind current day. And some of that has to do with how fatality data is reported, the nature of the volume of fatality data, a lot of valid reasons why confirmed fatalities related to opioids run about 2 to 3 years behind in the CDC data. But this research group looked at EMS data using NEMSIS data to try and determine closer to real time using our research data, how that correlates to confirmed cases after the fact using CDC data. And when they went and looked at NEMSIS overdoses and compared them to confirmed CDC overdoses, the correlation was almost perfect. So that R value of 0.98, a perfect correlation, meaning they match almost exactly 1-to-1, would be 1.0. So 0.98 is almost perfect in actual research. You almost never get values that high. So what that actually tells us is that for community overdose surveillance, the EMS data is an extremely good source of information and correlates very strongly with confirmed opioid cases. And then because of the timeliness, it can be used for things like community surveillance. The second case, this one was published in JAMA Surgery, is the association between response time and MBC mortality. So this one was pretty interesting. They looked just at a subset of patients in MBCs and whether or not the response time to get to those patients affected mortality. And I think anyone who works in EMS, this is not super surprising. The mortality increased as response time increased. Obviously, the error bars that you can kind of see in the dotted lines on either side of that graph expand as you get into larger response times. But for the most part, it's a linear trend. As response time increases, mortality does as well for each additional minute of response time. This one we used, NEMSIS is funded by NHTSA, the National Highway Transportation Safety Administration. They produce another data set called FARS, which is motor vehicle fatality data. And this data was able to be linked to the FARS data at the county level to determine these mortality estimates. The FARS data is interesting. So historically, a lot of the transportation data has relied solely on fatality data. And at the NEMSIS level, we have been able to calculate probability of survival because we get vital signs for each EMS activation. It's computationally very intensive. It's a lot of vital signs for a lot of EMS records, but we can actually go beyond some of this historical fatality data because we're able to look at probability of survival based on vital signs, and probability of survival less than 36.1 is our cutoff for severe injury. And so that's been something that's been very interesting, I think, both for us researchers and our federal funders, is to use a new data source that goes a little bit beyond just this kind of dichotomous fatal, non-fatal accident, and whether or not an individual is likely to survive based on vital signs in their field. And I should just take an aside here for any field providers listening to this. All the more important that your data is high quality and how much we appreciate it, because the data you're entering in vital sign fields is being used at the federal level for kind of large policy decisions based on motor vehicle crash probability of survival. And this was based on 2.2 million responses. So just kind of another quick note. I mentioned earlier that the volume of EMS activations that this research data set allows is really impressive and kind of unique. 2.2 million MVCs is a very significant number, and I think really generalizable because of its size. The third study is related to Uber. These researchers are economists, and they looked to see when UberX arrived in a study city, did EMS volume decrease? And it turns out it did. So there was about a 7% decrease in ambulance rate when Uber arrived in a city. This was a pretty interesting study. And I think it'll be kind of interesting to continue to trend this to see if the findings hold. But I don't know that it'll be really surprising to find out that a lot of low acuity ambulance volume was able to be referred to Uber. And then the fourth one, I found this one pretty interesting. Again, if there are any field providers who've ever been stuck waiting to cross a marathon, course in an ambulance, it's an uncomfortable wait. But does EMS response change during marathons? So they look to see if neighborhoods that were barricaded off during a marathon experienced delays in EMS cares. So they looked at 11 large urban marathons, and they found, not surprisingly, that transport times are about 4.5 minutes longer than when there's not a marathon. They also looked to determine if there was a risk-adjusted mortality increase during the marathon transport period. And it looks like there was a small increase as well, which is kind of interesting. This is, again, a huge number of activations. So when you look at the subset of almost 63,000 EMS activations for greater than 65-year-old chest pain patients, that's a very narrow research sample, research sample. But there's still a very large count of these activations. And so I think just kind of a testament again to the volume of records that we have even for a fairly specific impression. So with that, I'm actually going to hand things over to Angela Larkin, who's one of our master's level statisticians, to talk a little bit more about requesting research data and some things you can do if you're interested in requesting research data. And Angela, I am happy to stop sharing if you'd like and let you present the slides, or I can keep clicking through them if you'd like.
Oh, hey,
if you could keep clicking them. Oh, go ahead,
Ben?
Chris.
Oh, sorry, Angela. There is a question in the chat for you there, Ben. Barbara Stepinski is asking, how are duplicate records, first responder and transporting agencies for the same patient handled in the NEMSIS data set? Yeah,
so that's a really good question. We do not consider those duplicates. So it's really important to remember that in the research data set, really in all the NEMSIS data, each row is an EMS activation. So in a multi-tiered EMS response where a BLS fire-based first responder arrives first for a patient, and then ALS transport agency arrives second, they would both complete an EPCR. And that's sort of by design, even though they're for the same patient. So when we go back to look in our data, we would see 2 records for the same patient. So we have to be really careful. You'll hear us use EMS activation a lot because this is not a patient level registry. So there are some things we can do to try to narrow it to patients, but it will never be perfect. And there's some other kind of limitations associated with that. Typically, that means refining it to unit that transported the patient, and you lose anything that occurred before that transport unit's EPCR unless they document it as prior to arrival. So that's a really important limitation. So that's a good question.
Cool. Thanks, Ben. Sorry, Angela, for interrupting you. Go ahead.
Yeah, no worries. So I'm here to talk about some of the tips and tricks on how to request research data. Next slide. So some of the support that NEMSIS can provide researchers with, our team consists of 3 master's level statisticians, of which I am one. And then 3 of the main areas that we can provide support to researchers are masking and de-identification, which I'll get a lot more into later on in the presentation. Manuscript review. So if you are writing a manuscript and it uses NEMSIS data, we can review that manuscript and kind of help you assess whether or not the way you did your analysis is correct, and to help you understand limitations of our data and things along that line. And for longer data requests, we also do help and co-author papers. Next slide. Thank you. So getting started with your research request, I think the first and most important thing is to have a specific research question or purpose in mind. And to help decide whether or not NEMSIS data can help you achieve that purpose or answer that question, you can use some of the links here. These are just a handful of the resources that the NEMSIS website provides. There are a ton more, but these are the ones that I decided to share with you. The first link there is NEMSIS 101, which is exactly what it sounds like. It's a really good page to start to familiarize yourself with NEMSIS and to better understand what we do and the data that we can provide you with. The second link there is a user manual, and it describes how to use NEMSIS data and all about it, like some of the data sets that we can provide and all the different variables. The data dictionary goes a little bit more in depth into the variables that we can provide. I think Ben mentioned that there were, I think, 158 national elements. And so that data dictionary goes pretty in depth into each of those variables. Then there are the data definitions, which goes even more in depth into the variables. And then the second to last link are the case definition. They provide ways that the NEMSIS team defines different scenarios, such as cardiac arrest and stroke, to promote consistency across the industry. And then that last link just provides even more resources that you can kind of go into in your own time. So 3 big things to know when you request data, and 3 things to keep in mind are first, with masking, we can't provide any location data, so we'll have to mask those values. So if you want some NEMSIS data and you want like a zip code variable, instead of providing the raw zip code, we'll mask it, meaning that, for example, for each zip code 1, 2, 3, 4, 5, we'll switch it out for a random list of letters and numbers, so that you can't know that it's zip code 1, 2, 3, 4, 5. And that's to protect the states and to honor our agreement with them so that they are unidentifiable. Then the second thing, and kind of along that same idea of masking, is de-identification. If you have like a list of different variables and you want to add some NEMSIS data onto your own data set of variables, when we do that, along with probably some masking, depending on what variable you choose to connect the data sets on, we will have to adjust your data to make it, once again, so that you can't identify different locations. So for example, our data doesn't provide any kind of income information. So if you have like a list of zip codes along with their like average income, when you want to add NEMSIS data to that, we'll have to mask the zip code as I just described, but then we'll probably also have to round out those values so you can't identify those zip codes, because average income could be pretty unique. So in that case, it'd be like, oh, if there's only one zip code with $10,345 average income, then it's just kind of almost like a key to identify those zip codes. So we'll have to like either round those numbers or maybe even categorize them. So like income 0 to 10,000, all of those zip codes will have like group 1 and so on and so forth, or something along that line to once again protect the states and make their data unidentifiable. Then the last thing to keep in mind is that our data set is very large. Looking at this table towards the bottom, our 2020 data set size compressed, it doesn't seem super big, less than 15 gigabytes, but uncompressed, it's more than 100 gigabytes. So that's definitely something to keep in mind. And we can, if you email Ben or talk to anybody on the NEMSIS team using the links on the website, we can give you tips on how to kind of handle that. And yeah, so that's another thing to keep in mind is that our data is very, very large. So some key things to include in your request is to go into as much detail as possible about your research question and or plan. So obviously listing your question is very important because that allows us to kind of help you decide the best way to go about answering your question, but then also listing out the variables or outcomes of interest that you're interested in. So like, for example, like if you are interested in cardiac arrest, like, are you wanting that in counts or rates? And then what other variables are you interested in, including in maybe your analysis or whatever you're trying to do? It's important to make sure you have like a really good list of exactly what you're wanting. And then also including the definitions of different things. So when you say, for example, overdose, how do you want us to define that in your data set? Because just like last week, for example, I did a project that defined overdose in 3 different ways using our data. And then another one of our master statisticians did another project that also defined it in 3 completely different ways from the original 3 that I had. So it's really important that you can kind of define exactly how you're wanting to define your outcomes of interest or some of these broader terms such as overdose or cardiac arrest using our data set. And just kind of like in summary for that like little section, it's just best to be as specific as possible because that allows our master statisticians to best know how to do your request, and it will help us reduce the amount of time of having to go back and forth trying to figure out what you want and making sure we give you exactly what you're looking for whatever you're trying to do. And all in all, it helps us reduce the amount of time it takes to get you your data so that you can continue with your project and that we can help other people with their projects. And another thing you can provide us with is exactly what you're wanting from us. Like, how do you want the data that we give you to look? And an example of doing this is with the mock table, such as below. This is just an example. It's not based on any kind of NEMSIS data. But for example, you can give us something that kind of looks like this, like, oh, I want a column for a zip code and mean household income and education and so on and so forth. That's also something that really helps because then it helps us know and kind of pinpoint exactly what you're wanting and what question you're trying to answer, and it allows us to once again provide you with exactly what you're looking for. If you want to contact NEMSIS, here is some of Ben's information. He kind of helps a lot with the research side of things and discussing with you your request and exactly how NEMSIS can help you with it.
Yeah, thanks. And I'm seeing some questions come into the chat. So Barbara mentioned it's a lot of duplicate patients. Yes, and kind of. So one is this is a known design of NEMSIS. So we expect multiple records for the same patient. It may not truly be duplicate if it's linear. So if a first responder documents their vitals and procedures prior to an ambulance arrival. How that gets documented after multiple units are on scene can vary pretty wildly depending on where you are. So some agencies will continue to document what the ambulance on scene is doing. The ambulance may document what the first responder has done, or they may not, and it can vary a lot. So this is just kind of a known limitation of our data, is there's no way to deterministically link patients across responders. Ty asked, is an IRB required? We do not require an IRB to receive our data. So when you request the research data set, you have to agree to our terms of use in order to perform it. An IRB certainly may help on your end, depending on the nature of the research. The data is all de-identified, so there is no storage requirement as well when you receive the data. Even though we just kind of as best practice, we'll still send it in an encrypted format, but it does not require special storage requirements or explicitly an IRB to approve release, just the terms of use with the research request. Abhijay was asking about missing data, so exclusion versus imputation. That is a very complicated question to answer, and I would say depending on your actual research question, we should have a conversation about that. So depending on what you're doing, we may want to talk about imputation versus exclusion. And then Benny was asking about available formats. So we provide this data in SAS, which is a SAS proprietary binary file, Stata, and then an ASCII pipe delimited format. The pipe delimited format's a little weird. It's 3 characters. It's a tilde, pipe, tilde, which can be a little weird to parse. And then we offer SQL database table code in our on our online repository. That is really intended for internal use. So it's there if you would like to look at the Microsoft SQL Server code we use to create our database tables. But just know that we provide it kind of as a courtesy. It's not really intended for exterior use. And then Ty, you were asking about drilling down to counties. So yeah, we have 3 location variables. So we have incident, home, and destination, state, county, and zip. The incident location variables tend to have the most completeness, obviously, because they're populated when the incident is created. Destination tends to be better. Obviously, there's some expected missing values if a patient was not transported, and then home tends to have the highest missingness just because either a patient may not have a home or it may not be known at the time of the EMS incident. And I should also mention, so ZIP is the most granular we can map to. I know a lot of the data that we get requests to link tables to things like demographic information is at the census tract level. We actually can't go below the zip code level because of a technical limitation with how essentially the demographic files for where an agency responds to is created. For Benny, does the data come with a mapping document? Yep. So all of the information about variables as well as what tables they're in and additional information about how the data is formatted is all in the research data set user manual. And then do we have lat long? No, we do not. So that's not a national element. So we do not receive, well, for a couple of reasons we don't receive them, but one is lat long are not national elements. So they would not come to the national data set, as well as geocoded location information is essentially considered PHI, and we do not receive any PHI at the national level. These are all really good questions. I think I caught everything. Any other questions? We've certainly looked at other data formats. Most of our requests are for statistical programming software, which is where the SAS and Stata files are. I think as we start seeing additional requests for other software or data types, we will certainly consider producing those. Obviously, ASCII is kind of our fallback for any of the other data types. But if we receive feedback or start to get a lot of requests for other specific file types, we may produce those as well as we go forward. And then if at any point you guys have questions about whether or not a research project is doable with our data, or whether or not you could potentially link it to another data, not another data source. Our linking tables are almost exclusively demographic information. So they would be things like American Community Survey, population information, or race and ethnicity data, things like that. Please reach out to us because we're happy to talk to you about the process Angela described in terms of linking it to something like a location, and then that can be joined back into this data. So you would have at the EMS activation level some other demographic data like population in the county that an EMS call occurred. All right. Well, if anyone thinks of anything else, please feel free to put it in the chat in the last couple minutes, or reach out to us at the TAC. We're always happy to answer questions. And yeah, thanks, Angela. And Chris, I'm going to hand it back over to you.
Awesome. Thank you very much. A big virtual round of applause for our presenters today. Pretty sure appreciate the information and great questions. Again, if you need to refer back to this presentation, we are recording it, and it is going to be available shortly on our YouTube channel and on our main website. If you do want to be notified, like I said before, you can sign up for notifications on YouTube or on our Google group message. And if there's nothing else, would like to invite everybody to have a great rest of your day.